So here at Lubbock County Detention Center, we have 5 David, which is our special needs pod. And this is a specialized pod for mental health. The individuals in this pod typically have what we call a qualifying diagnosis, but when you walk in, it looks very different than your typical pod. You're going to see decorations. We utilize artwork a lot, so you're going to see Easter eggs around during the holidays. You're going to see the doors are decorated. You're going to see all sorts of decorations. And in this pod, I have a full-time counselor. It's a qualified mental health professional, and it is very structured. They are in classes twice a day. They have to wake up. They have pill call. Med compliance is required. And our curriculum, the Hazelden curriculum, is a CBT-based curriculum, and it is also incentive runs. And in this pod, we also have treatment teams every other week. So we have a multifaceted treatment team that's coming in and looking at medication management. Where do we need to be going from here? What's going well for you? What's not going well for you? Looking at different behavior plans. So it is a very specialized pod, and we utilize that incentives to be able to help them towards remaining medication compliant. I brought some officers through with LPD through our pod, and I took them in there and I showed them around, gave them a tour of the facility, and I had somebody pull me aside and said, "Hey, is that so-and-so?" And I said, "Yeah, it is." He goes, "That's the first time I've ever seen him, and he has given me a fist bump, and we didn't get into some sort of altercation." And so it just shows that, you know, these officers and other stakeholders, that what we're doing in this pod is working. We're getting these individuals stabilized. We're keeping them in this environment where they can thrive, and then we help them with resources, and we try to get them through the process of reintegrating and re-entering into society. We are awarded Senate Bill 292, and with that, we implemented jail-based competency restoration.
The judge sits here, and then the prosecuting attorney with the plaintiff, or just the prosecuting attorney, they will sit here. So, tell me who sits here. Jury. Great. That is awesome. Yes.
An individual will come in for their initial session, and they will be seeing a case manager, one of my 2 case managers, or they will be seeing the educator, the LPC educator. And so they are going to be seeing one-on-one sessions. They're going to be in group sessions. They are going to have attorney visits with the educator and the caseworkers. They will be taught in different learning platforms. So we have videos, we will give them flashcards, anything and everything, whatever they need to be successful in reaching maximum benefit of our program. As the restoration staff, our goal is to provide them the maximum amount of information and get them to the maximum potential that they will within our program within 60 days, and then we refer them for their final evaluation. So we are not the ones deciding if somebody has been restored to competency. We provide our education, we provide our services, and then we will make the referral, and then a psychologist will come in and do their final evaluation. A con to jail-based competency restoration right now is there is a certain amount of individuals that we cannot serve even though we are in a maximum security facility. You know, your aggravated assaults, anything like that, something that would warrant them going to, say, Vernon, North Texas State Hospital. We actually cannot serve those individuals. So with jail-based competency restoration, we wanted to alleviate those forensic wait lists. We wanted to take your larger counties and remove those numbers so it can be better served for the community. But we're not able to serve those individuals right now. So until there's some edits made to the statute, we will continue to be able to serve who we were serving in inpatient restoration and outpatient competency restoration. Being able to have a system that communicates with each other. You know, you have your judges that are working with your LPCs, that are working with the DA's office, that are working with, you know, your attorneys, your mental health attorneys. And so that pure collaboration and being able to pick up the phone and realize that we are all in this battle together. We are all working towards the same common goal. And I would say that has been our biggest success, is just successfully working with one another in our county.